That's another thing that's been normalized, and they literally call it the mom pooch. You put your mom pooch in your mom jeans, and that's something that's just been normalized, but it doesn't have to be that way.
You're listening to the Ethos Athletes podcast, where we believe that your health is the number one resource you need to accomplish your dreams. My name is Dr. Matthew Hernandez, and I'm a physician dedicated to helping my patients maintain their active lifestyle and continue doing what they love. I'm sitting down with other experts so that we can provide our listeners with the knowledge they need to improve their health and live their best life. Hey everyone, this is Dr. Matthew Hernandez, and you're listening to the Ethos Athletes podcast, where we give you resources to help keep an active lifestyle. Today, we're going to be continuing our Fit Mom series. For this particular series, we've been talking about health and taking care of yourself before, during, and after pregnancy. We brought on Ashley Allen, who is the owner of Ashley Allen Fit. She is an IFBB fitness pro and a pre- and postnatal fitness specialist who's a certified personal trainer. Today, we're going to be discussing pelvic health, and we brought on another guest for this particular episode. It's Dr. Jessie Duppler with the Doctors of Physical Therapy. So Ashley, Dr. Jessie, welcome to the show.
Hi, thanks for having us, Matt.
In this series, as I said, we've talked about health during pregnancy and making sure that women are taking care of themselves. Ashley's given her experience on how she's done that, or how she did that through her pregnancy, what she did after the fact to recover. And one of the biggest things that she really wanted to talk about was pelvic health. Ashley, when we say the word pelvic health, can you talk about what we're looking at? How is this something that affects women? And, what is it? How does it affect people?
Yeah, so when we talk about pelvic health, it's also your pelvic floor, your core, your glutes. So you're really talking about that trunk part of your body. And when you go through pregnancy, believe it or not, a lot of stuff happens down in that area. So you want to make sure that you prioritize taking care of that area, keeping it strong and connected. And it's really not something that is super mainstream yet. So if you're just learning about pelvic floor health now, you're not alone. It's not out in the open yet. It's still kind of taboo in America. That is one of the main reasons I wanted to talk about it, so that women can learn and know that certain things, feeling a certain way after you have a baby, is not normal, and it doesn't have to be that way. One of the biggest issues I didn't experience, but I know a lot of women experience just because I've seen it with my clients after they've had a baby, is bladder control. It's become normalized that women pee themselves when they work out or when they jump or anything like that. And that's not normal. It doesn't have to be that way. I know by training your pelvic floor, and especially after you've had a baby, if you're experiencing that even during pregnancy, seeing someone who specializes in training that pelvic floor can really help prevent and heal that area, so you don't have to deal with that forever. So that's why I'm excited to have Dr. Jessie here to kind of talk a little bit about that.
Ashley mentioned bladder control and having accidentally pee yourself, different things like that during certain movements. Is there any other thing that women experience, or even men for that fact, experience with having weak pelvic floor muscles, or, essentially there's weakness in the hips as well, right? And can you speak a little bit to that?
Ashley touched on this too, about how important the quote unquote core is when it comes to all of this. So our body never works in a silo. So we have the pelvic floor, we have the hips, we have the core. Our core in general, everyone always thinks of their abs when they think about their core. But what it actually is, it's more of a pop can. It's got sides, it's got top and a bottom. So we've got our abs in the front, we've got our multifidi and our small back muscles in the back. Then we have our diaphragm on the top, and our pelvic floor makes the bottom of that entire core. And so the core that we talk about is really a pressurized system. It's a system that actually supports our spine. And so if we don't have that pressure, what happens is basically we have no ability to support our spine. And so oftentimes what happens is, just like anything, there's the weakest link. Pelvic floor is typically the weakest link. And so when you do something like jump or, lift heavy, whatever is the weakest link is the one that's going to give out. And that's why typically we see urinary incontinence or something like that when people are lifting heavy loads or jumping, because this pelvic floor is not really ever trained. And so why that's a problem with people with pregnancy a lot of the times too is because obviously we have this baby in our pelvis now. And so what that's done is it's stretched everything. It's stretched our ligaments, it's stretched our muscles. And if we don't actually train all those muscles to basically work like they're supposed to again, then they're never going to actually contract like they're supposed to. So that's where hips and everything else starts to come into the equation as well too, because we have something like over 40 muscles that connect to our pelvis. And so when we have any sort of stretching of those muscles, all the other muscles that connect to that pelvis also then are affected in some way. Typically what we'll see is we'll see hip weakness that goes with that as well too. All of our muscles work on what's called a length tension curve. So if they're too close together or if they're stretched too far apart, they can't generate any force. And that goes for hip muscles and that goes for all of our small pelvic floor muscles as well too. So if you think about basically taking a rubber band and stretching it to its very end capacity, eventually that's going to break on you. So now you don't have the ability to actually support yourself in either your hips or in your core as well too. So that's why it becomes important to make sure that we're not only looking at just what's going on with our abdominal muscles, but what our hips look like as well too. Because when our hips attach to that pelvis, what they do is actually support the pelvis as we continue to regain strength with the pelvic floor and everything else too.
That makes sense. You mentioned the subject of pelvic floor health being a taboo thing. Is this something, like, in your experience throughout your pregnancy, did the doctors that you were seeing, did they have a conversation with you about this? Or is it more taboo between women who are, like, say, in your pregnancy group?
Yeah, so I don't want to make it seem like OBGYNs know what they're doing, because they do know what they're doing. They know how to deliver a baby. They know what to keep you. They know how to take care of your vitals and your overall health during pregnancy. However, they are not pelvic floor specialists. Most of them are not pelvic floor specialists. It takes years of education to get to that point. And the doctors I've spoken to, they only get a little touch on it in their schooling. So they may not know. I mean, I'm sure they know how to, if something, if a prolapse or something's going on, they know how to, diagnose that. But as far as treatment, a good OB should refer you out to someone. But it's not always a conversation that they have with you. It was crazy. I remember leaving the hospital when I had Savannah. This was 48 hours after I delivered. I had stitches. It feels like your organs are going to fall out of your body. And the doctor came in and she was like, all right, see you in 6 weeks. And I was like, what? I was in shock. I was like, what? You just saw me 40 times in the past 40 weeks. And now, after we just had this baby, I won't see you for 6 weeks. I don't know why I was so thrown back by that.
Because you should have been.
I should have been seen. I mean, I know in some other countries, you see a pelvic floor specialist in the hospital. So you start that rehab right away. It's just not like that here. It's not a part of our system yet. And I know, unfortunately, a lot of insurance companies won't even cover pelvic floor therapy, which is just mind-boggling.
Yeah.
It's crazy. So, yeah, it's just not the norm here. We've instead normalized things that shouldn't be.
Yeah. One of the other things we've normalized, too, is that, after you've had a baby, you'll just be in pain. I see patients all the time. I have a patient right now who's had back pain since her son was born, and her son is 4. And the OBs always say, yep, it's normal, it'll go away, and it doesn't go away. Yeah. And these women are never given the option of, hey, guess what? There's something you can do. One of my friends who's a pelvic floor specialist, her favorite thing to say is, you wouldn't trust your PT to deliver your baby. Why do you trust your OB to prescribe your physical therapy? Exactly. There's a lot of OBs that are really great at everything they do. It just seems that the ball kind of gets dropped a lot of the time. And so that's where I see a lot of women with tailbone pain, hip pain, back pain that's going on for years before it's addressed. And they're always just told it'll go away, or that's part of pregnancy, it's part of having a baby. And it's not. And women are just so good at putting their pain on hold or being like, well, yeah, now I've got a baby to take care of. I got other things I got to do. That it becomes years down the road where things start to really get even worse, because our body is really good at compensating even after a trauma like having a baby. And so our body will get away with stuff for a really long time until it can't anymore. And same thing with leakage. They'll be like, that's all right, I can handle it. They told me this was normal. And it's none of it is. So that's a really good point, that people that go through pregnancy and having a baby just oftentimes aren't given the information that they need afterwards.
Yeah, that makes sense. In the last episode, we talked about how a lot of women tend to prioritize going and working out, especially if they're active, before pregnancy. They try and going out, starting to work out again. Dr. Jessie, in your expertise, is pelvic floor strengthening something that should be prioritized before they start working out as a whole, before they start trying to go back, progressing to get to the lifts that they were before? Is this something that should be prioritized beforehand, or?
Prioritizing pelvic health means prioritizing the small stuff first, which is always what needs to happen. So any of the small muscles that we have in our body, we have stabilizers and we have movers. And all of our pelvic health muscles, all of our small hip muscles, all of our small back muscles, those are all of our stabilizers. When we have any sort of injury, not just pregnancy, any sort of back injury, a fall, anything, those small stabilizers tend to turn off immediately. immediately. And that's because our body always tries to protect us by just turning off the small stuff first. And so regardless of what's happening, it's basically like it's any other injury. Coming back, you need to start with the small things that stabilize you the most. And so when we say pelvic floor health, we mean not only the actual pelvic floor itself, so the muscles that actually control urination as well as actually support your pelvis, but also the muscles attached to it. So making sure that your spine is supported, making sure your hips are supported. Just like when I see my patients that have back pain with no sort of etiology, the first thing we look at is, okay, how are your hips moving? Can you control your movement? Because the biggest thing that ends up happening is we can't control our movement. And so then if you go, it's like, basically like anything, if you had someone come to the gym the first time and said, okay, go deadlift 200 pounds, we know that's not going to end up well. So starting back at the basics for anyone is really the important part. I mean, we'll go into a whole thing about what Kegels are and everything else, but there's, small exercises you can do for your pelvic floor. Not that I'm suggesting Kegels, they often are not what you need to do, but there's small exercises you can do for your hips as well too. And really, if you want to be high yield, that's where you want to start.
How would women know that they're having a pelvic floor weakness problem? And then how common is that in women with pregnancy versus not pregnancy? Like, do we know any of that information or?
I don't know any of that information, but I will tell you, if you've had a baby, you probably have some sort of pelvic floor impact.
Okay.
Just like if you've had spinal surgery, you have some sort of spinal musculature impact.
Yeah.
And I have patients that if you wanted to classify them as quote unquote pelvic floor patients, I have patients that are 50 and their kids are all in their 20s. And I have one patient she's 55, her kids are in their 20s. She's a CrossFit athlete and she has incontinence issues when she does double unders. And so, she's not had a kid in years and years and years and years, but come to find out, it's really her hips that have been out of place due to poor muscular function for years upon years upon years. So fixing that fixes the problem. So a lot of times things are masked as other things. A lot of people with low back pain come in who've had, again, kids years and years and years ago, and no one connects the two. And so we treat the impairment not just as similarly as we treat anyone that didn't have a pregnancy. So it's not necessarily that the stat is just related to women in pregnancies. We see a lot of people that have the same problems that all result from poor musculature function. If that makes sense.
Yeah, that makes perfect sense. Okay. What is traditionally done when we're talking about pelvic floor strengthening? So you mentioned Kegels.
I said, you want to say what people usually tell you?
Yeah, so the doctor will tell you Kegels, and Kegels, like Dr. Jessie said, a lot of it has to do with the hips, and Kegels aren't necessarily a hip exercise. Mm-hmm. It's not. Yeah, Kegels is the one the OB will recommend. They don't tell you how to do them, the proper way to do them. They don't send you to, at least from my experience when I've talked to other moms, they don't tell you what to do. So you're like, okay, so I just squeeze and like, okay, and I just, okay.
Am I doing this right?
Am I doing it right? But if you talk to a pelvic floor therapist, someone who's like super specialized in this, they don't have you do Kegels. They teach you how to instead use your pelvic floor with your diaphragm and connect that breathing. A lot of work that I've done on my pelvic floor, a lot of it's just breath work, because when you're pregnant, you become a chest breather and not a belly breather. So you lose that connection to your core. And the way you regain that connection is through your breath and learning how to use that diaphragm again. It's crazy. You literally breathe in your chest. It's so weird. You can't even take a full breath. But you have to really learn how to do it after the baby comes out. But that's like a big part of pelvic floor recovery, is just that alone.
Yeah. Anything to add, Dr. Jessie, as far as like some of the stuff that y'all look for?
Yeah, so kind of like what Ashley said, like Kegels apparently are the only thing that I don't ever gets told. And so basically what they're trying to do is they're trying to tighten up pelvic floor muscles that they think are loose or weak or however you want to say it. But now the problem is these muscles typically are already super tight, because when a muscle is weak, what happens is it doesn't loosen up. It tightens up in an attempt to do a job it can't do. So now with a Kegel, what you're doing is you're just squeezing a muscle that's already tight and you're not activating anything else that connects to that muscle.
Makes sense, yeah.
And that's like what Ashley said, why diaphragmatic breathing and diaphragmatic work is so important. And that carries really well into actually like lifting athletes as well too, because the exact same thing happens there. What happens when you have a baby is you now have obviously this mass, right? Mass is a terrible way to say that. But for the demonstration, all I'm saying is that what's happening basically is it flares your rib cage out and it flares your diaphragm out as well too. So now what happens is your diaphragm is up, which then can no longer actually create the pressure you need to oppose your pelvic floor. And both these things start to suffer. We see the exact same thing with people trying to lift heavy, in that they try and recruit a bunch of other muscles. And what happens is they end up having their diaphragm also start to stick up out of place as well too. And that's why you see a lot of that heavy back arching, those sorts of things in heavy lifting athletes, but also in women who are pregnant. You see this really big arched back. And so those are all things you have to correct afterwards. with, like you said, a lot of that diaphragmatic breathing. I feel like I got away from your question, Matt, a little bit.
No, you're good. We're talking about what are some of the things that you look for during that entire,
Thank you. Yep.
like
So
the treatment.
what I like to say to my patients a lot of times too is tightness is a symptom, not a cause. So we see this tightness in this pelvic floor muscle. So now we need to ask ourselves why. The answer is because they are weak. Okay, why are they weak? Because they've had a lot of load on them. Okay, what other muscles now are compensating or also need to be strengthened in order to support this? So one thing I do look at actually is breathing. Do they breathe apically, which means do they breathe in their chest up and down here, or are they able to actually take what's called circumferential breaths, actually use their diaphragm appropriately? The other thing I look at, we've talked a lot about this, is hip strength. We have these small internal rotators that attach from our femur, from our leg to our pelvis itself. And so when our pelvis is stretched, those muscles in particular also get stretched or shortened. And so we can check those by checking what your actual hip strength is. And so if I test your hips and I can win on a lot of those tests, it tells me that your hips are weak, quote unquote weak, or your muscles are shortened or lengthened. And that gives me some really good clues as to how the muscles in your body are actually supporting yourself. So that's typically where I tend to start there, as well as what the muscles in your back are doing to support your spine.
You talked about looking at hip weakness or hip strength and back strength. When we're looking at that aspect, is this something that like a pelvic floor specialist physical therapist will look at as well? Is there something that differentiates you as the outpatient physical therapist that you are compared to pelvic floor between the two when you approach pelvic health as a whole?
Good question, because I should differentiate. I am not a pelvic health specialist, but what I am is a movement specialist. And so there are people that are pelvic health specialists, and how I actually treat it as more of an outpatient or an ortho look is that everything is connected. So pelvic health specialists, what their kind of specialism is that oftentimes they will treat internally. So they will actually manipulate or work on the muscles that are your pelvic floor, the levator ani, all those small muscles down there. But what that's doing, it kind of goes back to our tightness is a symptom, not a cause issue. And the fact is they're treating the muscles themselves, those small muscles, by loosening them up, similarly to when I try and do like a QL release on your back or something like that. Yeah. But if you're just targeting that small muscle and nothing else, we're not going to actually get to the root of the problem. So that's why it's really kind of cool how specializations like pelvic health actually start to work their way into more the mainstream, basically, because what we do is we look at the back and the hips and everything else, because those are what's supporting the pelvic floor. The pelvic floor is a symptom of everything else that's going on. Yeah. So we see a lot of people that come in and say, oh yeah, I thought I needed a pelvic health specialist. I didn't want internal work, which is totally understandable as well too, but I didn't think you guys could do anything for me. And the fact of the matter is it's not just about the one muscle that's bothering you. My other favorite PT idiom is the culprit is silent, the victim cries out. The bladder leakage, all of that, those are all your symptoms of the victim. The culprit is the fact that you don't have the musculature to support yourself. We're able to solve a lot of pelvic floor issues, a lot of leakage, a lot of pain, a lot of back pain, a lot of tailbone pain by looking at the whole as opposed to just focusing on the small pelvic floor muscles themselves. And I think there's a great field that does that. The pelvic floor specialists are great at what they do. But the thing I love most about PT is we take a step back. Like, I know that you have pain when you lift, and I know you have pain when you leak when you lift, but I want to know why, and I want to know how we're going to fix those things in the long run, not just how we're going to fix that one type muscle.
That makes a lot of sense. And like you said, the tightness is a symptom. It's not the cause of the issue. So yeah, that makes perfect sense. Ashley, when it comes to pelvic floor strength, are there any other things that some of the women in your mom groups or some of the clients that you have that you've trained, and what other concerns do they have with regards around this? I'm assuming fixing it and getting rid of it is the biggest thing that they have. But any other questions that get brought up with this particular topic?
I think a lot of women experience pain, and they're told that's normal. Like we talked about a little bit earlier, it's normal after birth to experience pain. And yeah, it does take time to heal. But if you're comfortable enough to tell your trainer, if you're working with a trainer, you should be comfortable to tell them when you're in pain down there. Like if you're not comfortable to tell them that, you should find a new trainer.
Yeah.
If you're in pain, don't push through it. This is not a pain that you should push through. If you're feeling pain, ask to get referred to someone that can help you with that pain, because it doesn't have to be that way. I'm just trying to think of other things a woman experience is the abdominal separation.
Yep.
That's a big one. When you have a baby in your tummy, your abs separate. It happens to pretty much all women. And I know a lot of women live with that too. They don't realize that it's called the mom pooch, where the stomach kind of just sticks out and looks like your always 4 months pregnant. That's another thing that's been normalized, and they literally call it the mom pooch. You put your mom pooch in your mom jeans, and that's something that's just been normalized, but it doesn't have to be that way. Do you guys work with that?
So the medical term for that is diastasis recti.
Yeah. The reason
which is nicer to say. Which is nowhere near as mean sounding.
Yeah.
Actually, women who are more fit and have more muscle tone, more abdominal tone, typically see worsening of that as well too.
Interesting.
Yeah, and that's because what happens is, so it's diastasis recti is a separating of the rectus abdominis muscle. That's your six-pack muscle. We have 3 other layers of abdominal muscle as well. So we've got our very deepest one is called our transverse abdominis, and that's the one that acts basically kind of like as a girdle that goes all the way around and wraps around our sides almost to our back. That's the most important one, and that's the one if you do sit-ups all day long is not really going to actually hit. And that's the one also that is oftentimes the weakest in all of us. And so when we have this diastasis in which that the rectus muscle is actually separated, it's typically because we've had a lot of stress on it, i.e. a baby, and the transverse abdominis underneath it is not strong enough to be able to actually strengthen it again. So that's another instance actually in which pelvic floor is really helpful, because there's some really good fascial work you can do to try and help get that to come back together, as well as training the transverse abdominis and then those oblique muscles as well. So it's basically the 6-pack's part of a 4-pack as far as the abdominal muscles are concerned. And so when that's the one that's stretched, we need to make sure we're looking at all the other 3 as well to support it. So you're right. We see a lot of that. We see a lot of women who are like, yeah, this is just kind of how I'm hanging out now. And it's the exact same idea, is that this is part of that pressurized system that we need. And if the front part's not working, the bottom part's not going to work either. So yeah, that's a good point. That's a really common thing that we see, that again, women are just told, hey, it's normal. Hey, work through it. Hey, it'll be fine. Yeah. So we got to stop telling women that.
Yeah. I just think it's just become so normal over the years, but I know there's a lot of pelvic floor specialists on TikTok that talk about this a lot.
Nice.
And Instagram. So hopefully it just gets out there, and hopefully personal trainers like myself, they start educating themselves, because if you train women, 80% of those women will have a baby or have had a baby at some point in their life. So you will be doing your clients a disservice if you don't get educated on this topic, because women deserve better.
Yeah.
That's a great point to make. So you mentioned for someone who has a coach that they train with, if they have the fear of saying that they're having any issue, they should potentially find a new coach, right? But what are some of the things that a coach should be doing proactively to figure out, if their client is going to have any issue with that? What are some of the things that you do to kind of make sure that all that proactively is going to be good?
So number 1, get certified in pre and postnatal fitness, specifically with Girls Gone Strong. That's where I got mine. They are the leaders in this industry for training for women. Educate yourself as much as possible so you know what to look for. And then when you do your client intake or your consultation, ask thorough questions, and don't be afraid to poke too deep, because sometimes they might tell you something, and if you dig a little bit deeper, they're like, oh, I thought that was normal. And it's like, no, we can work around this. And then if you dig a little bit deeper, then you might, if it's out of your scope of practice, then you're going to be able to refer them to someone who can really help them. And then they're going to be even more grateful for you. So I think number 1 thing as a coach is ask questions, especially if you have a client come back after they just have had a baby. Understand what they've done between birth and now. Where are you going to start with them? Because if they haven't done anything, any sort of recovery at all, then they need to before you throw a barbell on their back again, or have them deadlift or lunge or anything.
Yeah.
So it's just important to make sure you're just digging a little bit deeper and asking those questions.
Awesome. Ashley, if anyone wanted to get a hold of you, what's the best way for them to do that?
So they can email me, ashley@ashleyallenfit.com, or follow me on Instagram @ashleyallenfit.
Perfect. And then Dr. Jessie?
Yeah, same thing. So you can email me at Dr. Jessie, DrJessie, @thedoctorsofpt.com. I know it's kind of long. You can see our website. We're also on the Instagram at Doctors of PT. We have a Facebook page that's pretty live with a lot of good tips as well, too. Or you can give us a call. Our number is 480-482-0651. I'm fairly certain.
Awesome. Perfect. Thank you all for really shedding some light on pelvic floor weakness, strength, and how we can go about getting that addressed and not making it as taboo for people. Ashley, Dr. Jessie, thank you so much for being on the show.
Thanks so much, Matt. It's been great.
You. Thanks for having me. It's been great.
Yeah.
Thank you.
Thank you all for listening, and we'll catch you on the next episode.
Having issues with low energy and staying mentally sharp? Your hormones can play a role on how much energy and focus you have throughout the day. Our team at Ethos Integrative Medicine loves working with busy individuals who want to feel their absolute best and get the most out of life. Ask our team how you can get more information to learn about our unique approach to hormones so you can continue to take on the world.